chronic hemolytic anemia. There are some agents that may cause hemolytic anemia in glucosase phosphate dehydrogenase. Some of the agents are infections. One common infection that we talk about is diabetic ketoacidosis. DKA is the hallmark of type 1 diabetes, where there is increased level of glucose and ketones. Of course, it can be acetoacetate, hydroxybutyrate, all those ketones in urine. The etiology is not all that known how diabetic ketoacidosis affects G6PD deficiency patient. One infection is hepatitis. That's A and B. Okay, when you are G6PD deficient and you also get hepatitis A or B, it may increase your risk of hemolysis, may hemolyze the red cell. Okay, and so people with G6PD deficiency are to protect themselves against hepatitis A and B. Typhoid can cause hemolysis, pneumonia, cytomegalovirus, just to mention a few. Very important. And then the drug aspect. This is where my interest is, because most of the people we deal with, our patients, they are naive, and therefore when they go to places to buy drugs, when you give it to them, they just take it anyhow. Some of them don't even know their G6PD level or their G6PD status. So they take in drugs, develop reactions, hemolytic episodes, complaints day in, day out. So it is our work as clinicians or medical officers to advise the public to always come and check their G6PD deficiency. And to most medical directors, every patient that is being given these drugs should be allowed to check the G6PD level, because these anti-malaria drugs, primaquine, pamaquine, chloroquine, fasida, morphine, all these drugs leads to hemolysis when the patient is G6PD deficient. Sulfonamides and sulfones, example, cotramazole, sulfanilamide, dapsone, and sulfalazine, all these drugs trigger hemolysis. So if you are G6PD deficient, you are not advised to take this. Other antibacterial drugs like nitrofurans, chloramphenicol, all these drugs trigger hemolysis. Analgesics, aspirin, antihistamines, all these can lead to G6PD or trigger hemolysis in G6PD deficiency. Miscellaneous, vitamin K, analogs, naphthalene, all these can cause hemolysis. And so if you are G6PD deficient, it is never advisable to take in any of these drugs. Fava beans, which is well known to trigger hemolysis, G6PD deficiency. Don't even venture. Fava beans, don't venture if you're G6PD deficient. Soy, peanut, legume, all these can also cause, but the most important one is the fava beans. Okay, so this is the fava beans I'm talking about. Okay, if you're G6PD deficient, don't go there, because it is one of the common food substances that trigger hemolytic episodes